a stock bottle. Some of the stock bottles have 30 tablets or 90 tablets. So sometimes the pharmacy gives you the full stock bottle. But other times, the stock bottles have a lot of tablets in them, like 500 tablets. So they can only give out 30 tablets. So they take these off. We have a lot of these in the pharmacy. They're usually just thrown away because there's so many of them. You don't need that many. So I decided to collect some. And we can go through them and learn a thing or two. Tonight I have 4 medications. We have Eliquis, and the generic for it is apixaban. Eliquis tablets. We have sertraline tablets. We have duloxetine delayed release capsules. Duloxetine delayed release. And then we have amlodipine tablets. We have a mystery one that got a little ripped, so we're gonna have to find out what this one is when we open it. Okay, so first and foremost, let's start with our brand name medication here, which is Eliquis. Eliquis is a blood thinner. It's quite expensive. A lot of insurances don't cover Eliquis, and it can be quite expensive for a lot of people. It's very important for people to take it regularly if they're at risk of a stroke or heart attack, since it lowers the chances of having one. So it's very important that people have regular access to it. So it being super expensive is pretty unfair, but what you gonna do with the brand names? You can't really do much with them. Okay, for now, I'm not gonna open the full thing because it's very big and I'm not gonna have enough space. So we're just gonna focus on this part for now. So as you can see, let me zoom in for you guys a little bit. Let me do some video magic up in here. Look at that. Look how sophisticated our studio has become. Premature discontinuation of Eliquis increases the risk of thrombotic events, which is basically getting a clot, which can be very, very dangerous. To reduce the risk, consider coverage with another anticoagulant if Eliquis is discontinued for a reason other than pathological bleeding or completion of course therapy. So you definitely want to make sure you're talking to your doctor if you're going to be stopping this one. You don't want to just stop it, and especially if your insurance isn't paying for it, try to talk to your doctor and make sure that you keep continuing to take some kind of anticoagulant, because this one's pretty serious. You don't want to get a thrombotic event. Spinal and epidural hematoma, not quite sure. Haven't learned about this. May occur in patients treated with Eliquis were receiving neuroaxial anesthesia or undergoing spinal puncture. Oh, I think it's increased risk of spinal bleed if you're going to undergo some kind of spinal procedure. Any kind of cut can increase the risk of bleeds. Let's see. We can zoom in even more here. Eliquis. Eliquis is a factor XA inhibitor indicated to reduce the risk of stroke and systemic embolism in patients with non-valvular atrial fibrillation and a deep vein thrombosis. Thrombosis is a clot, which may lead to a pulmonary embolism, which is a clot in the lungs. If you get a blood clot in the lungs, it's an immediate emergency in patients who have undergone hip or knee replacement surgery. So a lot of people that undergo surgery are taking Eliquis. The normal dosages for these things is about 5 milligrams daily, twice a day, so 5 milligrams a day. If you're taking 5 milligrams, 10 milligrams per day. Then there's some other dosage recommendations here. And then if we go here, we can see the dosage forms and the strengths. There is a 2.5 and there's a 5. The 5 milligram is the most common one that's sold. We also have a 2.5. If you have an active bleed, you don't want to take Eliquis. If you have a bleeding disorder, it can make things a lot worse. And of course, if you're allergic to Eliquis, you don't want to take Eliquis. Again, since it's a blood thinner, it can cause serious potential fatal bleeding because if you get some kind of cut or bleed internally, externally, your body's going to have a hard time clotting and stopping the bleed because Eliquis is stopping it. So it can be a lifesaver and it could kill you, so you just gotta use it correctly. You gotta evaluate the signs and symptoms of blood loss. And you gotta use something to reverse the inhibition of the XA factor. So your blood can clot again. That's some of the warnings. If you have any adverse reaction, you should contact here so you can report it, so you can put it in the data books. These are some of the drugs that can increase the blood levels of epoxyban. And you probably don't want to take them together. Co-administration. Let's see. Use in specific populations. If you're pregnant, it's not recommended. Lactation, discontinue it if you're breastfeeding, or you have a severe liver impairment. Hepatic means liver. It's not recommended to take it for people who have severe liver impairment. Let's see. This is just like a table of contents. We can go down to the indication. Let's go to the indication. Eliquis. Indications and usage. The most important purpose for Eliquis is the reduction of risk of stroke and systemic embolism. It reduces the risk of stroke and embolism in patients in non-valvular atrial fibrillation. Deep vein thrombosis is also another clot that you can get following some kind of surgery. And then, if you want to treat deep vein thrombosis, you can also take Eliquis. Pulmonary embolism is a clot in the lungs. Pulmonary means lungs. Reduction in the risk of reoccurrence of deep vein thrombosis or pulmonary embolism. So it also, taking it regularly can reduce the risk of it happening again if you already got treated for it. And again, just the recommended dose. Take 5 milligrams taken twice daily. Characteristics. The recommended dose of Eliquis is 2.5 milligrams twice daily in patients with at least 2 of the following characteristics. Age greater than or equal to 80 years, body weight less than or equal to 60 kilograms, serum creatinine greater than or equal to 1.5 milligram per deciliter. So if you have any of these characteristics, you're not going to get 5 milligrams per day. You're going to get 2.5. If a dose of Eliquis is not taken at a scheduled time, the dose should be taken as soon as possible on the same day, and twice daily administration should be resumed. The dose should not be doubled to make up for a missed dose. You can have temporary interruptions if you're having surgery because your risk of bleeding can become much higher if you're on Eliquis. So if you're before a surgery, you want to stop Eliquis. If you are switching from warfarin to Eliquis, warfarin is also a really popular blood thinner. If you're switching, warfarin should be discontinued, and Eliquis started with the ratio, the correct ratio, international normalized ratio. So you don't want to be taking 2 blood thinners at the same time. Your body's not going to be able to handle that. I'm pretty sure these are, don't quote me on this, I ain't no doctor. I think these are cholesterol medications. I'm not quite sure. Wait, let me see. What does it say here? Patients already taking 2.5 co-administration with Eliquis stroke. Yeah, I'd have to see. Right down over here. Ketoconazole. That one is an antifungal. And this is a antiviral. Never mind. I don't think this is a cholesterol. These aren't cholesterol medications. Something else. Anyways, administration options. For patients who are unable to swallow whole tablets, 5 milligram or 2 may be crushed and suspended in water. 5% dextrose in water. Or apple juice. Or mixed with applesauce and promptly administered orally. Alternatively, Eliquis tablets may be crushed and suspended in 60 ml of water. So you can, if you can't swallow pills, if you have a hard time swallowing pills, you can do that. We know the dosages enoxaparin is another blood thinner. I guess they're comparing different blood thinners after knee surgery and hip surgery. Okay, but that's all for Eliquis. Next up, we have sertraline. Sertraline. Sertraline is a SSRI, or a serotonin something inhibitor, reuptake inhibitor. It's an antidepressant medication. It's quite common with people with depression. Some people describe it as making them feel numb. Others say it's pretty good. So, the brand name for sertraline is Zoloft. not working at the starting dose, you can titrate to 25 to 50 milligram per day, once weekly. This one, if you have liver impairment, you don't want to start at the maximum dose. Recommended starting at maximum dose is half recommended dose. And if it's severe liver impairment or moderate, you don't want to take this one. Not good for you. Okay. So then we have a little bit of a summary. Suicidal thoughts and behaviors, serotonin syndrome. Maybe we can read a little bit about serotonin, increased risk of bleeding, activation of mania or hypomania, discontinuation syndrome. These medications, if you're on them, you really don't want to discontinue them abruptly. You want to taper down before you stop taking them because it can really affect you. Let's read about serotonin syndrome. Serotonin syndrome, or serotonin norepinephrine reuptake inhibitors, or SNRIs, and SSRIs, including sertraline, can precipitate serotonin syndrome, a potentially life-threatening condition. The risk is increased with concomitant use of other serotonergic drugs, including triptans, tricyclic antidepressants, fentanyl, lithium, and tramadol, methadone, tryptophan, buspirone, amphetamines, and St. John's wort. St. John's wort is actually a over-the-counter herb, I believe. It's some kind of herb or plant that people take that supposedly has mild antidepressant effects. But you don't want to be taking that with sertraline at the same time. And if you do that, it can impair the metabolism of serotonin. And serotonin syndrome and signs may include mental status changes, agitation, hallucinations, delirium, coma, autonomic instability, tachycardia, liable blood pressure, dizziness, flushing, hyperthermia, many things, neuromuscular symptoms, tremor, rigidity, hyperflexia, incoordination, seizures, and gastrointestinal system. So overall, serotonin syndrome, even though this is supposed to be an antidepressant drug, it can have effects all over the body. The concomitant use of sertraline with MAOIs is contraindicated and any cocaine, serotonergic agents immediately if above symptoms occur, and initiate supportive symptomatic treatment. So, serotonin syndrome is a big risk for these medications. Increased risk of bleeding. Drugs that interfere with serotonin reuptake inhibition, including sertraline, increase the risk of bleeding events. Recommend use of aspirin, which is a blood thinner, and a painkiller, but it's also a blood thinner. Non-steroidal anti-inflammatory drugs or NSAIDs. That's like ibuprofen, naproxen, or Aleve, Advil, all those over-the-counter stuff. Other antiplatelet drugs, warfarin, and other anticoagulants may add to the risk. So, what did we learn from Eliquis? Eliquis is an anticoagulant, so we probably don't want to take sertraline with Eliquis. And based on the data published, observational studies, exposure to SSRIs, particularly in the month before delivery, has been associated with less than twofold increase in the risk of postpartum hemorrhage. So, a lot of bleeding risks if you're also pregnant and you're on sertraline. It can activate mania, which is a overactivation of neurological activity. Patients with bipolar disorder treating a depressive episode with sertraline or another antidepressant may precipitate a mixed manic episode. Reported 0.4% of patients treated with sertraline reported having this kind of mania. And then, this one is pretty serious. Discontinuation syndrome. Adverse reaction after discontinuation of serotonergic antidepressants, particularly after above discontinuation, include nausea, sweating, dysphoric mood, irritability, agitation, dizziness, sensory disturbance. You can have tremors, anxiety, confusion, headache, lethargy. Many bad things can happen. It is a gradual dosage reduction that's recommended if you're going to stop taking sertraline, because your body gets used to having these SSRIs. So if you stop abruptly, it can have a big problem. It can have a big problem. Seizures even. Look at that. Sertraline has not been systemically evaluated in patients with seizure disorders. Patients with a history of seizures were excluded from clinical studies. Sertraline should be prescribed with caution in patients with a seizure disorder. So, they haven't even studied what sertraline does on seizure patients. Oh, look at that. It can give you glaucoma, too. A lot of side effects with this one, huh? Oh, interesting. Look at this one. You can have a false positive urine screening test for benzodiazepine. If the patient reports being on sertraline. False positive tests result in a expected for several days following discontinuation of sertraline. So that's interesting. If you're taking sertraline, it can make the test come as positive for benzodiazepines. They must share some kind of chemical that is tested for. And a mass spectrometry is needed to help distinguish from sertraline and benzodiazepine. Benzodiazepine is things like Xanax or alprazolam. Those are used for anxiety, but a lot of times they're also abused. They can be abused often and they're quite addictive, so people do test for them in medical health care settings to make sure that people aren't on those medications or stealing those medications. That's all for Searchly. Next up we have amlodipine. Amlodipine. Amlodipine is a beta blocker, I believe. We'll see if I'm right in a second. It is prescribed for high blood pressure. It's a very common medication that's taken for high blood pressure. I believe it's one of the first medications that's prescribed if you have high blood pressure. Right here, you can get a little summary of what amlodipine's for. Highlights. Highlights do not include all the information needed to use amlodipine safely and effectively. Full prescribing information, blah blah blah. Approved 1992, so this is a pretty old drug. It's for hypertension. Hypertension means hyper blood pressure. High pressure, but it's high blood pressure. Amlodipine mesylate tablets are indicated for the treatment of hypertension to lower blood pressure. Lowering blood pressure reduces the risk of fatal and non-fatal cardiovascular events, primarily strokes and myocardial infarctions, which is a heart attack. Coronary artery disease, chronic stable angina, vasospastic angina, angiographically documented coronary artery disease in patients without heart failure or ejection fraction. Dosage and administration. Adult recommended starting dose is 5 milligrams per day. 5 milligrams once daily, with maximum dose of 10 milligrams once daily. Small, fragile, or elderly patients or patients with hepatic insufficiency may be started on 2.5 milligrams once daily. So most of these medications, if you have some kind of liver impairment, it's going to affect it a lot. Affect how good it's going to work. Because your liver metabolizes all these things and filters out all these medications throughout your body. Let's see. Amlodipine is contraindicated in patients with known sensitivity to amlodipine. So if you're allergic to amlodipine, don't take amlodipine. Warning: symptomatic hypertension that causes problems is unlikely, because that's what it's supposed to treat. Patients with liver failure, increased angina and myocardial infarction. Worsening angina and acute myocardial infarction can develop after starting or increasing the dose of amlodipine, particularly in patients with severe obstructive coronary artery disease. And then if you have a hepatic failure or liver failure, because it is extensively metabolized by the liver and the plasma elimination half-life, 56 hours in patients with impaired liver function. Titrate slowly when administering amlodipine with patients with severe liver impairment. That's all for amlodipine. Next one we have is duloxetine. Duloxetine is an interesting one. It's used as an antidepressant, but also as a painkiller. Specifically in, I believe, peripheral neuropathy in diabetic patients. Diabetes can cause a lot of pain, so this one is prescribed a lot of times to treat that. As we can see, it's prescribed for a lot of things. It's prescribed for major depressive disorder, generalized anxiety disorder, diabetic peripheral neuropathic pain in adults, fibromyalgia in adults and pediatric patients 13 years of age and older, and chronic musculoskeletal pain in adults. So take some kind of drug for antidepresssion, you want to be careful not to discontinue it abruptly. Otherwise, you get some bad symptoms. You got seizures. This one is our last one. This is our mystery medication guide. It's been ripped off, so we have to open it to see. I was going to guess this one is olmesartan. I saw the O. But to be fair, I did just cheat and I saw the olmesartan written on there. Olmesartan is a antihypertensive, which is it reduces blood pressure. ARB, olmesartan is ARB indicated for the treatment of hypertension in adults and pediatric patients 6 years or older, alone or with other hypertensive agents to lower blood pressure. Lowering blood pressure reduces the risk of fatal and non-fatal cardiovascular events, primarily strokes and myocardial infarctions. This one is contraindicated with patients with diabetes, so if you have diabetes, do not go administer aliskiren with olmesartan tablets in patients with diabetes. Control of high blood pressure should be a part of. Control of high blood pressure. Control of high blood pressure should be a part of comprehensive cardiovascular risk management, including, as appropriate, lipid control, diabetes management, antithrombotic therapy, smoking cessation, exercise, and limited sodium intake. Sodium can be quite bad for your blood pressure. Many patients will require more than one drug to achieve blood pressure goals. For specific advice on goals management, see published guidelines. Blah blah blah. There's a lot of different blood pressure medications, as we've seen. Amlodipine is also another one. Lisinopril is a different one. We also have valsartan. These are all blood pressure medications to reduce blood pressure. There's some kind of contraindication with NSAIDs here in patients who are elderly, volume depleted, including those who are on diuretic therapy or compromised renal function, which is your kidney function. If you don't have good kidney function, co-administration of NSAIDs, including selective COX-2 inhibitors, which is like selective COX-2 inhibitors are, one example would be Celebrex or celecoxib, with angiotensin II receptor antagonists, including olmesartan, may result in deterioration of renal function, so it can really damage the kidneys. It can has something he needs real bad, including possible acute renal failure. These effects are usually reversible. Just monitor and make sure that their kidney function is getting monitored when they're doing NSAIDs and Olmazor. But yeah, that's Olmazor. That's our mystery. That's our mystery thing. Mystery medication. That's all the medications we have for today. If you guys would like to see more medication guide ASMR,